Hi, my name is Stephen, and I'd like to welcome you to the Laser Eye Surgery Secrets Revealed video. Now, laser eye surgery is also known as Lasik, so I'm going to interchange between Lasik and laser eye surgery for the duration of this video. So in this video, we're going to cover certain different areas. The first one is, what is Lasik? Then we're going to explain the Lasik procedure. We're going to look at what happens after Lasik surgery. What are the expected outcomes from Lasik? And questions you must ask your Lasik surgeon when you're getting your free consultation. This is critical. And finally, how much you can be expected to pay for laser eye surgery. So what is Lasik or laser eye surgery? It's basically primary surgery used to treat nearsightedness, farsightedness and astigmatism. In less than 30 minutes per eye, it reshapes the stroma, which is the middle portion of the cornea. So let's now look at the Lasik procedure itself. In order to access the stroma, the surgeon cuts a flap in the upper portion of the cornea, right above the pupil. Numbing drops are then put into the eye and the eye area is cleaned. Now there's something which is known as a lid speculum actually holds the eye open while this is happening. High pressure is applied to the eye with a suction ring that is briefly placed directly on the eye. Then the flap is cut. Now I don't want to go into the medical terms particularly, but this is called a keratectomy, which may be done by either one of two methods. The first one, the time-tested way, uses something called a microkeratome, which is basically a cutting instrument or blade. The newer method of cutting the flap is by laser only. This is sometimes known as the brand name Intralase. After the suction ring is removed, both Lasik methods are nearly identical. So the corneal flap is then folded back and the exposed tissue is allowed to dry. Then the patient is asked to stare at a light for about 60 seconds to help keep the eye fixed and immobile. In less than 1 minute, the Lasik computer pulses high energy ultraviolet light, removing the tissue that was previously determined to reshape the cornea most effectively and accurately. The Lasik laser makes clicking sounds and there may be a smell of burning tissue. After very precise amounts of tissue are removed from the stroma, the surgeon lays the flap back into place. The eye is then observed for a few minutes to make sure that proper bonding is taking place. So what happens after the surgery? Well, once the surgery is complete, a protective shield is placed over the eye to prevent pressure and anything from bumping the eye. Since there are no stitches in Lasik surgery, these precautions must be taken to ensure that the flap remains in place. Some patients return to work the next day, but most doctors recommend that you wait a few days. Strenuous activity and non-contact sports should be avoided for up to 3 days. Facial products and makeup are out for up to 2 weeks. The eyelashes may need to be scrubbed fairly often during this time to help prevent infection. And no contact sports are allowed for at least 4 weeks. Expect to leave off swimming, hot tubs, whirlpools and saunas for up to 8 weeks. So what are the expected outcomes from Lasik? Well, most Lasik patients see huge improvements in their vision by the next day. Vision may continue to improve for 3 to 6 months post-operatively. While visual fluctuations may occur temporarily throughout the day, this tendency diminishes over time. Now, Lasik eye surgery is not for everyone. Most good candidates follow their surgeon's pre- and post-operative directives faithfully. They find their vision and therefore their lifestyle greatly enhanced by this laser procedure. Now, the reality is you won't know if Lasik is for you unless you see a Lasik specialist. Nearly all Lasik consultants provide free consultations to let you know if you are suitable, so I highly recommend you get a free consultation. Thanks very much for watching this video. I really hope you found it useful. Now, if you want to get your free Lasik consultation, which I highly recommend you do, as it's totally free, won't cost you a penny, all you have to do is to go to www.lasik-for-u.com/YouTube. So lasikadviceforyou.com/YouTube. Now I'm going to give you time to type that into your browser right now. So type that in, and I'll leave this website address on the screen for you, so you can do that now and you'll go straight to the page. As I said earlier, thanks very much again for watching this video, and I hope you found it useful.